All right, good afternoon, class 114. Instructor Morris here, and it's not really going to be a test review, but it's more of a quiz review because I was going through the quizzes and just kind of glancing through, and there is quite a few of you guys who didn't answer question number 1 correctly, concerning to me a little bit, and so I want to go over it and see maybe where you guys missed something, or you wasn't thinking good this morning, or what have you, because it's stuff that we've kind of covered a lot of. So here we have the quiz up. We have question 1 right here in front of us, and I hope you can see it, but if you can't, I know a lot of you guys listen to this in your car, etc. So let me just read it. And so question 1, you are responding to a person down. Find a male in his late 30s lying, or in this case laying on the floor. He responds to pain. Airways open, breathing is shallow, and there is a weak radial pulse. You notice a large amount of blood all over the floor. Unknown where the blood is coming from on arrival. Physical exam shows blood-soaked pants and no entry or exit wounds. Blood pressure is 94/62. The pulse rate is 124. Respiratory rate is 24. What should you do for this patient, and what is your course of treatment? And so let's look at some important details here. All right, so person down, okay. He's in his late 30s, okay. He's laying on the floor, okay. Responds to pain. So that will go with our AVPU here in a second. His airway's open, which is nice. His breathing is shallow. Important. There's a weak radial pulse. Weak radial pulse. All right, you notice the large amount of blood all over the floor. All right, unknown where it's coming from. Physical exam, it's going to be the blood-soaked pants. They tell you there's no entry or exit wounds. It really doesn't matter at this point because we're going to have to expose him in a second. 94/62 is important. The heart rate, very important. Respiratory rate, important. All right, so let's look at the checkoff sheet for National Registry real quick, and it kind of starts at the beginning. So PPE, okay, scene size up. So the scene size up in this case is a male patient. He was lying on the floor with blood-soaked pants, so we can see blood. Don't know where it's coming from. Determines the scene is safe. It appears to be safe. Mechanism of injury or nature of illness. This is kind of unknown right now, but we know what we have. We're going to have to investigate that a little more. Number of patients in this question, there's 1 patient. We're going to request an ALS unit to be en route and consider stabilization of the spine. I think we should consider that, considering we don't understand the mechanism, so we'll play it safe and have somebody take C-spine control. All right, primary survey verbalizes the general impression of the patient. All right, so the general impression of the patient in this case is what they give us. He is breathing shallow, and there's blood in the floor. He's in his late 30s. It appears to be a male. And that would be our general impression. The chief complaint and apparent life threats. He responds to pain. He's definitely not alert, so it's going to be hard to get a chief complaint. The life threat in this case will be the blood. We have to find out where that is coming from. So our first course here then, our first course of action I'm going to write it up here. expose. We're going to expose. Sorry for the writing, guys. Pen's not working that great. We're going to expose. Stop the bleed. All right, so that's our first order of business. Because we're going right per the check sheet. All right, so what's our next item here? So that would be a life threat, the bleeding, if it's uncontrolled. So we're going to assume it is, and we've taken care of that. The next order of business will be the airway. In this case, we have an airway that is open. So airway is open. We like that, and that's good. Breathing. All right. We've said it a million times. Million, billion, trillion times. What does it tell you about the breathing here? That is shallow. Shallow means it's inadequate. That's inadequate breathing all day long. So we are going to have to provide positive pressure ventilation. The airway is open in this case. He responds to pain, so let's assume he has a gag reflex. So we're going to use, in this case, nasal airway. Okay. Followed by positive pressure ventilation. Okay, biggie, guys, you got to get that. I'm not going to be angry, but I am going to be angry for a second anyway. I want you guys to start really getting that. I have no doubt in the field that you guys are going to get that. It's so, I know it's so much easier to observe this, but when you're reading, you guys got to slow down and catch that, because it's going to be on the National Registry exam. It's going to be on this upcoming exam. You've got to be able to recognize shallow is not good. It means failure, and provide positive pressure ventilation. Next on the list. Oh, man. Next on the list. Let's see here. Breathing's handled. Okay, now we're going to do circulation. Okay, so we're going to check for a pulse, and I believe this patient has a pulse. It says he has a weak radial pulse, and later in the question it's told us that the heart rate is going to equal 124. That should tell you a lot. Tells you that he's tachy, and we know there's bleeding, and because we've already stopped any type of uncontrolled hemorrhage. We know he is tachy, has heart rate of 124, and that tells us hypoperfusion. That's enough for us to go off right now. We have blood on the ground, we have a heart rate of 124, hypoperfusion. Okay, but we're treating that right now. Positive pressure ventilation. We're attached to an O2 tank at 15 plus liters per minute, and we're dealing with that. We're dealing with the hypoxia on that end. So we should prioritize this patient. And he's definitely an urgent, right? No doubt about that. This patient is going to be an urgent or high priority patient. We're not going to be able to get much of a history from this guy. So if there's any bystanders, we'll consider. The question doesn't provide that. So we're going to assume that we can't get any history. This will be a rapid secondary assessment, where we're going to check everything from the head to the toe. We're going to listen to lung sounds when we get to the chest. We're going to palpate the abdomen. We're going to check the pelvis for stability. We're going to continue down the legs. We're going to check for pedal pulses in both left and right lower extremity. We're going to check CRTs. We're going to see if the patient responds to us touching his feet. Okay, we're going to come back up. We're going to check both right and left upper extremities. We're going to check that radial pulse again, CRTs, etc., and be done with that. All right. Secondary assessment is done. All right. Or rapid trauma assessment is done. So if we can transport now, we're going to, and we would like a set of vital signs. So let's get a set of vital signs. And we could have got that right after we did our primary survey, but it's perfectly fine to do a rapid secondary and then get your vital signs. So let's see what we got. We get vital signs of blood pressure of 94/62, which will confirm our patient is hypoperfusing. Heart rate's going to be 124. And the respiratory rate continues. I assume it's going to be assisted to 24 at this time with the positive pressure ventilation. All right, so the question, what is the question asking us? It says, what should you do for the patient and what is your course of treatment? Well, that is our course of treatment, what we did, and what we should do is provide rapid transport to the hospital. All right, and treat the patient for whatever caused this blood to present itself. Okay, and we don't have to, we don't have to really determine in this question. We don't have to determine it's anything. It could be a GSW, it could be GI bleed. It doesn't matter. What matters about this question the most is that, one, we recognize that we would control any type of uncontrolled hemorrhage, and two, that we provide positive pressure ventilation and treat the patient appropriately for hypovolemic shock. Next question. What is wrong with the patient? Question number one. Well, it doesn't matter if it's a gunshot wound or any of that, but what's wrong with the patient? Well, the patient's suffering from hemorrhagic hypovolemic shock is what the patient's suffering from. He's suffering from that, and he's hypoperfusion. Hypoperfusion is a problem here. So that's exactly what's wrong with the patient. It's not asking us to say what is wrong with him as far as what is the cause of this bleeding or what's the cause. It's not asking you the cause, it's what's wrong. And what is definitely wrong is the patient's in hemorrhagic shock. And that's really the two questions. I really didn't even look at three. We can look at it briefly here. Responding for a 68-year-old female complains of shortness of breath. She advises you that she is having a very hard time breathing and is out of her medications at home. Okay. On assessment, you find a patient has an open airway, breathing's labored, 28 breaths per minute, pulse is 140, and blood pressure is 134/86. Patient's wheezing in the lungs, and your partner decided to give an inhaled bronchodilator to help this patient. Please state what medication you would be giving. What's the mechanism of action for this medication, and how would you give this medication? All right, so let's find the important stuff here. 68-year-old female, shortness of breath, hard time breathing. Okay, out of medications at home. Okay, assessment by the patient. Patient has an open airway. Nice, we'll keep that. Labored though at 28. Labored doesn't mean that the patient is in respiratory failure. Labored is just that. Labored means patient is working to breathe. Okay, we're higher than average. We're at 28, but this patient's not in failure. Pulse rate a little high at 140. And we get a blood pressure of 134/86. So patient's still perfusing quite well. Blood pressure is 134/86. Even with this high pulse rate, this patient still has good cardiac output. Not hypoperfusion. Okay? pulse labored at 28 and pulse at 140. Definitely we're going to treat this patient appropriately with some oxygen, but let's talk about it. So we'll use a trauma assessment for now. Let me flip over there real quick. Trauma assessment. So, because it's similar to the medical assessment. PPE, scene size up. Scene appears to be safe. The mechanism of injury or illness is difficulty in breathing. Number of patients. Apparently there's one patient. We're going to request an ALS unit to be en route, and does not appear that trauma is a concern here, so we're not going to worry about stabilization of the spine. All right. So we're going to get a general impression of this patient. The patient appears to be labored breathing. The patient is, let me flip back. Patient's 68. She's a female. And difficulty in breathing would be the general impression. There's no obvious life threats, no obvious bleeding that we need to worry about. The patient's conscious. All right, and we're going to go down to the airway. The question states that the airway is open. Nothing to do there. Doesn't say that the patient's gurgling, that there's vomit, anything in the airway. The airway's clear. It's open. Breathing. Again, labored. Did not say shallow. The question does not say inadequate. The question does, none of that. This says labored. Gives a rate of 28. The pulse rate, well, hang on a second. I think we are ready to go to that. Yep, so we're going to talk about the circulation. Pulse rate is going to be 140. It doesn't say where it's at. It says pulse. We'll assume a radial pulse because that's where we would be checking with a conscious patient. Okay, and then now we will prioritize this patient. We will make this a high priority patient just due to the fact that during our primary assessment, the patient has a labored respiratory rate of 28. It's not normal, therefore, and the pulse rate is not normal either, and therefore we'll make it a high priority patient. Here's where we'll try to get a sample. All right, signs and symptoms. Difficulty in breathing, labored is what we get. Wheezing is a sign and symptom. Okay, A for allergies. Does not indicate that the patient has allergies. All right, so medications, we know the patient is out of their medications, so whatever that might be. We know the patient takes meds, but we're not sure what they are. And prior medical history doesn't really tell us. Doesn't tell us about a prior medical history. All right, last meal doesn't tell us. Events leading up to the event doesn't tell us that either, I don't think. Time to breathe. This says that the patient's been having a hard time breathing. Not much on the onset. If we wanted to do an OPQRST, no mentions of provocation or quality. Severity doesn't mention other than hard time. And response stage, home suspend, way open. Doesn't say anything about when this started. Okay, so we've gotten as much information as we can get from this. So let's see what the question wants answered. All right, please state what medications you will be giving. All right, so we know that it says we've decided to give an inhaled bronchial dilator. So that kind of gives some of that away, right? We should know that a good bronchial dilator is albuterol. So we're going to give albuterol as our bronchial dilator. And we're going to also give the Atrovent with it. Brothers and sisters, and they never travel by themselves. So it says, please state what the medications you would be giving would be. So that's the first thing it wanted, and we gave it to it. We gave the answer. All right, so what is the mechanism of action for this medication? So the mechanism of action. So we are going to say that the mechanism of action here is that it's a bronchodilator. Okay. I'm going to abbreviate that. All right. That's probably not the right abbreviation, but you get my point. Bronchodilator. All right. Let's see here. Mechanism of action. Let me highlight that so that we'll know that's the second thing that it wants. All right. Mechanism of action for this medication. And how would you give this medication? So bronchodilator and albuterol adjuvant, it's a bronchodilator, and we're gonna give this by nebulizing this with oxygen, and we're going to nebulize that between 5 to 8 liters per minute. And we should know the dose, right? So the dose is going to be 2.5 milligrams of albuterol and 0.5 of atrovent. All right. Now that's pretty much all this question wants. And then we answer that question. And we're done with the quiz, right? But what brought me to doing this video was question number 1. Like I said, quite a few of you guys missed that. You got to read, guys. Got to read, okay? Righty. So, all right. Study for your test tomorrow. You already had a good review. You should do fine if you took notes during the review and you're studying the way that I told you to study. I look forward to seeing you guys tomorrow. And until then, happy studying.